unique here at the Institute for Neuro-Immune Medicine. And we designed it this way. It wasn't by accident. About 10 years ago, we designed an institute that would have a clinical care piece, research component that was very broad and went from bench, from laboratory-based science through to trials and eventually actually affecting the standard of care, not just in our own clinic, but nationally. That was our intent. We wanted to create a place where you could come with a really complicated illness and get the best possible care. But we also wanted to learn from that and with very innovative research designs put into play, studies that would eventually really move the needle and really help people with very complicated illnesses. And we made it happen. It's 10 years later. We have a most amazing research institute here that encompasses all of those things and also embraces the idea that we're teaching the next generation of scientists and providers to be able to do this. We are studying complicated illnesses, post-viral illnesses now, post-COVID. Long COVID is one of our big focuses, but it's right on the heels of many years of work in myalgic encephalomyelitis, or chronic fatigue syndrome, which is another post-viral illness that's very debilitating. We are studying neurotoxic injuries, particularly military neurotoxic injuries. Gulf War illness is one of our big focus areas. What's unique about us is this ability to have a bench scientist, a computational biologist, a clinician come together and say, how can we do this faster, do this well, really make a difference in real time in ways that help people now. To give an example, it might take 20 years to take a brand new product from the idea stage through all the different stages of development, all the way through phase 1, 2, and 3 trials. The work we're doing is moving things in a much faster timeline, maybe 8 years, because we're able to incorporate all this work and be ready to jump into the next step and the next and the next, and be effective enough that the people that fund these, the agencies, see our grants very favorably because we really are delivering on our promises. One of the ways that really helps us get there quicker is to have philanthropic giving allow us to jump into a new area, like long COVID. No money at all for long COVID, but we jumped in with philanthropic giving so we could quickly move our ME/CFS-like work into work that would help people with post-viral illness of the current pandemic. Or philanthropic giving that allows us to do all the pilot work that leads to the data you need to get a grant. You just don't get a grant with an idea, you get a grant because you did a whole bunch of work first. And so we really have used these donations strategically to have a mission in our institute that is to really deliver at the end an effective strategy. Sometimes we have these great big cool ideas that are potentially even curative strategies for long-standing, really complicated illnesses. And that's what we're doing, and we're doing it with your money, so thank you.